it was really strange. I could feel it permeating throughout my body. And it was like a rush I was getting. And all of a sudden I could see clearly, literally, while I was getting the infusion. And it was just, for me, like, oh my gosh, this is a miracle drug.
Thank you for joining us today on Mobile Nurse Revolution. I am your host, Will Bozeman, and we have some great guests today. I just wanted to point out quickly, if you're watching this and you have questions about mobile nursing or anything in that whole realm, different things you can do, questions you have, Kim is an expert, you will find out, and we are going to learn more about what she does in the world of mobile nursing. And we will jump straight into that now. Kim Fredricksen, registered nurse. And would you mind telling us a little bit about yourself, where you're from, if you feel like telling some of the details, and then we'll get into some of your experience as a mobile nurse.
Yeah, I'm from Tucson, Arizona. I've been a nurse 26 years and joined Relative. It'll be 2 years in July. So this coming up, next July. So about a year and a half. But I did labor and delivery my whole career. So obviously women had pain during childbirth. So kind of used to that. But, in childbirth, they're giving usually, most of the time, some drugs. I kind of turned more holistic the past couple of years and just got sick of the sick model of healthcare and just decided I just want to work with people, holistically. Will's plan is nice with the machine because it is holistic. And it really made me love nursing again. I've hated nursing for probably the past 6-7 years and just wanted to get out of it. And so this has given me like a new love for nursing. It's really impactful for the patients.
Thank you. No, that's thank you for saying that. I appreciate that. I'm sure there's a lot of people out there who probably feel the same way you do. Now you have someone with you today, and she is also a nurse, correct?
Yes.
Kay Lombard. And Kay, you can, maybe introduce yourself, where you're from, and we'll go more into the mobile side of this.
Okay. I'm a registered nurse, and I started nursing school in 1976. So that just tells you a little bit about how old I am, 67 years old. And I primarily worked trauma or ICU. I worked in over 42 different hospitals throughout my career because I traveled for like 18 years.
Wow.
And so I was really cocky and really good. And then in 2003, I was assaulted by a 300-pound woman who had overdosed on heroin and PCP. And she broke my nose, broke phalanges in my neck, broke 4 ribs, and separated my brachial plexus from my bicep tendon.
Oh, wow.
So I have something that is called thoracic outlet syndrome. And as a nurse, in Arizona, it's a right-to-work state. So for 7 years, I struggled with passing out every time I hung an IV. And they kept saying that I was faking it and milking the system for 7 years until I passed out in front of a trauma surgeon in the middle of a trauma.
Wow.
So I have right-sided weakness, neuropathy, but the my biggest concern was, before I started this program with Kim, I was having nerve spasms and vasospasms that were just beyond measure. When I started, I literally was unable to do this because the tremors and the vasospasms and the nerve spasms were so off the charts that I couldn't do it. I couldn't hold. I was like this, and Kim's like, "Okay," So within my second treatment, I had started, my vasospasms and my nerve spasms were so bad in my thoracic outlet, and then they said, all along in my neck that I was having double vision. And so
Wow.
the first time Kim gave me the glutathione infusion, it was really strange. I could feel it permeating throughout my body. And it was like a rush I was getting. And all of a sudden I could see clearly, literally, while I was getting the infusion. Wow. And it was just for me like, oh my gosh, this is a miracle drug. I can't believe this, Kim. You know,
that's just glutathione, right? I mean, it's actually, you looked it up. I mean, yeah, glutathione does quite a number of things. But yeah, keep going. I didn't mean to interrupt you, but that's amazing. Yeah, keep going.
Yeah. So I'm a trauma nurse, so I'm used to explaining things and painting a beautiful picture for you. Okay. So when I first met her, I was unable to do the dishes. I was unable to do laundry. I was unable to change my own bed. I couldn't do any of that thing because the spasms I were having were so off the charts. And the doctors were telling me that it was all psychosomatic because I'm going through a horrific divorce. So I'm like, okay, I'm crazy. All right. So Kim's been my therapist as well. So it's just been amazing to me. And like this morning, I'm going to cry. I'm going through this divorce, so I had to start work again. I'm 67 years old. I had to go back to work full time. And that's how I even met Will and then Kim, was I applied to be a mobile nurse. But I'm flat broke, way in debt because my ex-husband is just, we're not going to go there. But it's just amazing to me because 6 weeks ago, I was 67 years old and I was crying every day. And I was just simply in computer training for my first week of full-time employment at 67. And I was crying. And then Kim would come and I'm like, oh, I can do this now. I can handle this. I can be a nurse again. She can help me. So when she got here this morning, I used to tell people, I think my pain is like a 12/10. When she got here, I was pretty close to a 12/10. And I wasn't sure how I was going to handle this because this week I saw, as a Medicare home health nurse, I saw 19 patients in 5 days. And I had a PICC line occlusion 4 days in a row, that kind of fun stuff. So a year ago, or even how long we've been doing this since July?
Yeah, July.
So in July, I couldn't have even considered working again as an RN. It wouldn't have even entered my mind. That's why I approached this program, was because I thought, oh, I can put a monitor on somebody. I can do that, But to me, the glutathione and the treatment is just like right now. I just so.
I know. Some of the things you're talking about, I think it's a common theme in mobile nursing, is that the patient experience, the nurse being able to spend a lot of quality time with a patient in their home. It's very personal, right? It takes the whole hospital thing out of it. Like you mentioned, you worked in dozens of hospitals, and ultimately being in the hospital, like you just mentioned, it eventually got to you. Literally got to you. Someone actually harmed you. You're in a place where everybody there is, it is difficult. I mean, mobile nursing probably isn't, 100%, safe from any harm, right? I mean, you're going around to people's homes, but you do get to, often decide who and what you work with. You have a lot more autonomy. But what you did say though, is that you look forward to Kim coming to see you. And I know Kim, I mean, and a lot of people probably don't I just mentioned before the show, like, we have a mobile program, and Kim works with us in this mobile program. But, this show is actually just, it's not specifically about what we do, but it just so happens that we all do this together too. So it's kind of it makes for an easy conversation here. But I've heard this from a lot of people outside our company as well, is that the mobile nurse that starts to get to know someone, they really do become friends. And it's more than just a medical relationship, more than just a business relationship. You really are And as one other nurse put it, you're part of their family. And another nurse that I talked to said that she gets invited to family events.
Mhm.
They invited her to barbecues. They invited
Yep.
her to things like that. They'll
Yep.
make treats or prepare a treat for her to go home with. So I mean, it is just a different experience altogether, being a
It,
mobile nurse.
it is. And for me, after dealing with trauma ICU all of my career, coming to that and having someone come into my home to make me feel better, I can't even tell you the value of having a incredible nurse like Kim. It just changes everything. I didn't recognize that I could potentially really be depressed, even though the doctors told me I was really, really, really bad. But a month before I met Kim, I thought I had had a literal stroke because I lost vision in my eye and I wasn't able to move my right arm and my right leg. And the doctors all told me, no, it's all from cortisol. And so I think the glutathione also played a role in that too. But it's just amazing how this particular treatment for my particular insult has just been extraordinary.
Well, that's wonderful to hear. And Kim, you did mention once that you've had some pretty remarkable outcomes with people in your experience. I mean, like you just mentioned earlier, I appreciate you saying this, but you said you hated nursing. You got to the point where you hated nursing, and I won't speak for you here. I'll let you speak to this, but it sounds like this. I mean, in part, the treatment that you're offering is probably very beneficial and useful to people. It fits in with your personal views on, cleaner, holistic medicine, non-pharmaceutical medicine. But on top of that, I mean, you're able to do something with more independence and freedom. So,
Mhm.
if you want to talk more about that, tell everybody more about what that feels like, just to be able to love what you're doing again, like just and your experiences with how that's changed your outlook. Go ahead.
Yeah, I mean, definitely the past few years before I started this, I was trying to go into psych nursing. I was trying to go into what else? Just different types of nursing because I just was like, I got to get out of the hospital. There's got to be something better. I just wasn't happy. And so therefore, didn't want to work there. I wasn't even barely working or picking up that many shifts, needed the money, but and I've always wanted my own business. So that was the cool thing. And yeah, and then you forgot to say I was the first nurse doing this.
Yes, you were. Yes,
Yeah,
Kim's the
so
original, the OG,
I'm the
the original.
OG. Yeah.
He is the OG.
But it's just, you're right, the freedom, the flexibility, and my patients are awesome. They just they go with the flow with me. I know I've told you, Will, but my mom died 2 weeks ago or a week and a half ago, and I had about 2 weeks of where I was at her house daily, and my patients so understanding because you do bond with them. And I mean, the patients that I have are just wonderful, and they're like, you know what, you need to take care of that. And so that's also a nice flexibility. I also tell the other nurses too, that you can go on a vacation. I mean, you don't want to be taking a month off of patients, but if you work it out to where you do their treatments before you leave and get them when you come back, I mean, it's okay to make, even have a week and a half, 2 weeks off at a time. But, and that's if, like the patients are okay with that too. But I think they know that you have a life as well. And so, yeah, but it's just, I've always wanted my own business, and this one was just great. And I love, like I said, I love coming to people's houses. I do bond with them. They are my friends. If they have problems, I help them. If I have problems, they help me. So they are like family. And really, you're not going to get that in the hospital. I wasn't going to get that anywhere. So really happy doing what I'm doing.
Thank you. Thank you for that. I mean,
Yes.
and I'm sure there's a lot of people that are hearing that and just kind of, probably daydreaming about this as well. Like, being able to do what you're doing.
All nurses dream. I see nurses when I worked in the hospital that had just graduated and after a year are burnt out and they hate it. So, it's nice that nurses have options.
Yeah, I mean, a friend of mine from years ago reached back out. I know their family, but she reached back out and said, "Hey, I just graduated nursing school," and they knew I had something to do, and they didn't know what I did, but they knew I was involved in something medical, and they asked me what I was involved with and if I had any suggestions or anything for where she might work. And I was like, I don't have any suggestions for where you work. As a nurse, you have the privilege of going into any direction you want, which is really nice. And then and they knew about the mobile program stuff that I'm doing with you guys, and I just said, you know what, I mean, you're welcome to do that, but I'll tell you what, maybe give that hospital down the road where you live, give them a shot so that you can appreciate being a mobile nurse, and you know what it's like to be in that hospital for a 12-hour shift or overnight. And then and I've had other nurses tell me that when you are in a mobile scenario, that you're the only person, right? There's no one else to back you up. There's no one else to support you. If you aren't sure what you're doing, make a mistake or something happens. So you do need some good experience, right? Right. I've had a few nurses say, even if you're doing just simple IV infusion stuff, you got your own IV infusion business, and there's lots of companies around that do that. But if you don't have a lot of experience with it, and you're out in someone's home by yourself, doing an IV infusion for vitamins or something like that, yeah, you never know what's going to happen. Right. And if you don't have experience, and the hospital can give you that experience. So maybe everybody does need to cycle through the pain for a while before they can get to something like this. So let me ask you this. So I know you're doing, for everybody watching, Kim is working with a pain treatment program. It's a mobile pain program that does non-pharmaceutical pain treatment for patients with chronic pain. But that's not the purpose of the show here. And so we'll talk about other stuff, meaning there are lots of different things you can do in the world of mobile nursing, right? One of the things that I know Kim has done, I don't know all of your history, but I know that you have done also just general, like, self-pay IVs, like people that would do, like, hey, I want a vitamin infusion or hangover IV, or right, something like that. So tell everybody what that's like. Is that worth doing? Do you recommend it? Is it difficult, or is it just easy money, or what's the scenario there?
Well, I think when I started, I was working under someone. She lived in, she's a nurse practitioner, Andrea, but she lives in Phoenix. So I live in Tucson. And I would, you kind of got to market yourself. So, I haven't had like the best, plus I'm so busy sometimes that I don't have time to do it. But, I'm not a fan. I do social media, but, I'm older and it's like not my favorite way to do things. But so here and there I'll do some, which is nice. And again, just meeting more people. And then there's been times when just doing the IV therapy for them, they'll be like, well, what else do you do? And, so I can kind of tell them, well, I treat chronic pain and I come to people's homes, and they were like, so I actually can sometimes get, patients from that as well, which is nice. But yeah, I mean, I think if I was in a company down here in Tucson, I'd probably get, more of that type of stuff. But I also still have my own business as well. And I do like hair tissue mineral analysis to see, if there's any heavy metals, stuff like that. And I also have made that kind of mobile because some people don't know how to cut their hair right for the sample. And then,
so
I also
basically that's a diagnostic test then.
Yeah, I do also functional lab testing as well. Okay. So all the tests the doctors won't do for you that will actually give you like a root cause of where everything's coming from. So,
and you do that.
It's probably just kind of made me more, doing this job has made me more like, because I see some patients that are really sick and really need to change some lifestyle stuff. So even with this program, we do like coaching. We do some coaching with them and try to help them know that like water is very, very important in Arizona. And that, if these older people aren't getting enough water, they're going to be in more pain. So, But yeah, so I've kind of expanded, some things in my business, which is good.
Nice, nice. I mean, and so I know all over the country, I've talked to probably thousands of nurses around the country, and most of them have heard of like the cash pay mobile IV programs. You can just sign up. There's a company that's got a blanket medical director. You can go out and do cash IVs. And most of the nurses I talk to say it's fine, but it's hit and miss because somebody who wants an IV today might not want one for months.
Right.
Another one for months. Or if somebody wants an IV, they want it like right now or today, but they aren't scheduling it for a week out. So it can be kind of stressful, and it's hard for people to, plan for that when they don't know when someone's going to want it.
Right.
And I've talked to people who do concierge, other stuff, med spa stuff. I've talked to lots of nurses who've done that. They'll go around and do mobile Botox and along with an IV and facials and all sorts of stuff in a mobile scenario. And I've talked to a number of people that do that. So I mean, it just kind of depends on your preference, what world you want to live in. And I've talked to some nurses that had been. There was a nurse, one in particular I'm thinking of, where she was doing a couple different things. She was working with our company too, but she backed out of all of that to just focus on doing mobile cosmetic stuff on her own. And because she just wanted to have fun, she wanted to get away from treating people for problems and issues and just go and work with people who just wanted to, I mean, literally for vanity's sake, if you will, just, cosmetic stuff like that. She just wanted to have fun and be happy and not worry about, having to try and help someone that has, a complaint or an issue. And that's just her preference. And I think that nurse in particular had been in some pretty heavy nursing, emotionally heavy nursing roles for years. So she was like, I'm done with the emotional drag that I go to work every day. And I'm required to engage in some very, very sad things. And I'm just tired of that. She's like, I just want to get away from being pulled down, not because I don't want to help the patients or anything. It's because I carry it with me. She's like, I carry it home. I think about it. I'll dream about it, and it's just hard. She's like, I need to do something just fun and light. And I told her about the pain program. She's like, that sounds great too. She's like, but I'll tell you what, she's like, honestly, I wouldn't even want to do that. I would just want to go and do facials and Botox for people that just want to have a Botox party and do some IVs and everyone talk and laugh. And I was like, that's wonderful. It sounds like you need a break from the difficult aspect of healthcare and nursing. But I will say most people who've done the pain program that you're doing, Kim, I've heard lots of people say a very similar thing, that this gives them a chance to see someone actually get better, and kind of turn a corner, at least from where they were, into a positive direction, right? And like you're saying, Kay, before Kim came along, you're having a much more difficult time with everything. And now you're saying, it's, I guess, I don't know if you would call it a 180. Is it a 180 for you? A complete reverse course?
Absolutely. Absolutely. Like right now sitting here, when she got here, like I said, I felt like I was a 12/10 because I had today worse nerve spasms than I've had in 3 or 4 weeks. And so it was pretty intense when she got here. I was gritting my teeth. It was that bad. And now I'm like, hey, how you doing, Will?
It's pretty much as soon as I turn the machine on, she's
Gotcha. Yep. Well,
but I think another thing too, if you were talking about the nurse just being sick of the jobs, that they have. So, in the beginning, I was training all the new nurses, and that is a common theme with the nurses, is that they just want to help people. They genuinely want people to feel better without using drugs, without having surgeries, so I love that sometimes people will come and do this and they're deciding on a surgery, and not saying it always happens, but it can happen to where they feel good enough that they're like, because I know one of my patients had a back surgery and then she got neuropathy from it. because they severed something, so like I just eek. Anyway, yeah, so I just think nurses genuinely want to help people. I love that. And I have to say, this job is like super simple. Okay. It's like no stress. You come over, you're talking to the person that you've been working with forever, and you put their machine on them. They're happy to see you, usually every single time. And then some get IVs, some don't want IVs, whatever. She loves her IV. We get that set up, and then her and I, can go over some things. We chit chat. It really, compared to bedside nursing, oh my gosh, like I said, that's why I love it. I love that, like, it's my own business. If I'm running late, I just let her know. If she's running late, she lets me know. There are no, time constraints usually, and it's wonderful.
Well, look, that's wonderful to hear, and I greatly appreciate how much you enjoy what you do. It makes me happy. I've said this to people for years. It doesn't even matter what you do and what your industry is. If you see somebody who's happy with their work, happy with what they're doing, it makes you happy. I've met people who are completely different career fields from me, and they're just happy. And I was like, that's awesome. And I love that. And just, seeing you be, in such a good state, and being able to help people that need it and see them, get better, and also enjoy what you do, and have some freedom and autonomy. Like you said, you decide when your vacation is. That's amazing, right? You decide.
I don't have to ask management and be like, hey, I need this time off. And they're like, sorry, you can't, like, 2 other people are going, so. Yeah,
exactly. It's like, you don't have to deal with that. If you're running late, you just text the patient, but there's nobody you have to go and explain it to. It's, it's really nice. And I'm hoping that whoever's watching this, there's probably going to be a number of nurses who are, watching this while they're in a hospital, waiting to clock out. and if they do, that's great. We can talk to them. And I'll tell you what, so look, I don't want to keep you forever. I know you're in the middle of working together. Any last comments about mobile nursing that you'd like people to know, or any last thing you'd like for people to know before we sign off?
Like I said, I did 26 years, that was too long. And I pretty much had a bad attitude. So, I was not happy. So definitely it showed with patients and all that. And, our whole goal, I'm a healer, right? It's like, I was born to be a healer, and I wish that there was a way I could make her feel as good as she gets from this machine. That's my only caveat. But anyway, we also can do neurosage with this, which, I kind of geek out on that a little bit, because I'm like, my hands can actually do it. Yes. She's never tried that yet, by the way. So, just.
So Kay's never experienced that from you? No?
No.
Not yet.
Well,
not yet.
For anyone who's watching, what Kim's describing is, there's a high pulse electrical device that Kim's using there for the pain treatment, and what she's just talking about is a circuit where half the circuit is on the nurse, the other half is on the patient, and wherever the nurse puts her hands, she conducts the actual current through her hands
on the nerves,
on the patient, right? And you can actually put your fingers and right on the actual nerves, and directly, and just hold it there and let the current hit it. What we noticed over the years is that people with back pain issues and neck pain and things like that, you can get your hands and fingers right into that spot on their back where the pain is. Like, where exactly is right there, and you can get that high pulse current that is inhibiting the pain signal right where it needs to be. And some people have said that is they'll never do anything else. That's all they're going to do is the neurosage, and then on the other side of that, scenario with neurosage is like full body. You don't have to target like one spot on a back.
Right.
You can actually work, all of the muscle lines and the nerve lines and stuff like that. And people are getting, one of the things that occurs is like a release of neurotransmitters, neuropeptides during the process. So people do tend to feel good and just alert. They sleep better that night typically. Neurosage is a pretty fun treatment. But like you said, it is that feeling that your hands are the conduit of,
Yes.
of healing and health. And that's really cool. It's just fun to be able to actually do some hands-on help. It's like, feels like it's like, when you go out and work in the yard, you feel like you did something. If you put your hands on and work with people, you feel like you're doing something.
Right.
It feels good. I know how you feel about that. Well, look, thank you. Kay, any last comments from you before we sign off here?
If anybody's interested in doing any kind of mobile nursing, they should really, really pursue it, because the medical system is broken. And now that I've been back to work full time as a home health nurse for Medicare, for me, it's just criminal how we are treating our elderly, and how the lack of medical care and available community services for our elderly is gone. And it sickens me. So anybody that's interested in it, you can make a huge difference in your community, just simply by being a nurse that cares. I was hung up I was trying to advocate for my patient who has septic arthritis last night, and the hospital operators at the hospital hung up on me 4 times when I explained to them that I was a registered nurse concerned about my patient's sepsis, trying to keep him out of the hospital. Will you please page the doctor? They told me no 4 times and hung up on me. Wow. So if it's happening to me, I just can't imagine how it's happening to the human, Joe, Snoopy, or whoever's out there. It's just awful how these people are being treated. And it's happening every day, and we can make a difference. We can make a huge difference. And I petition each and every nurse that's interested in it. Go for it, baby.
Yes.
Go for it.
Well, thank you. No, I appreciate you saying that. And like, hey, this whole episode here has displayed that, someone like Kim who's doing this can make a real impact in a very positive way on people in her area. And in doing so, enjoy all of the benefits that she just described, and the freedom and everything like that. So I hope that if you're listening out there, anybody who's listening, if you have questions about this, Kim, if you're okay, I'll even put your contact info in the description of the show here. People can reach out to you directly if they'd like to ask you questions about your experience and stuff, if you're fine with that.
Absolutely.
Sounds great. And I will, we'll go ahead. And then I will also have contact info for me in the description as well. Any questions you have about mobile nursing, reach out to us, ask the question. If you are a mobile nurse and you have great experiences and great stories, I'd be more than happy to interview and let you share some of your experiences on the show. Thank you all for listening. Thank you all for watching. You are listening and watching Mobile Nurse Revolution, and I will see you all next time.
All right.